To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hello and welcome to Your Health. Today we're talking about cavities, specifically in our kids. We'll talk about some good oral practices to help avoid those cavities. I'm joined today by Dr. John Krupka of Krupka Dental. And doctor, how do I even know that my kid has a cavity?
Well, you can look in their mouth and see if you see any dark spots, and those should be checked out. But you cannot see decay starting between the teeth without having x-rays or pictures taken of those teeth. And by the time you can detect it in your child's mouth just looking, they've broken and they're having major issues at that point.
Well, let's talk about what happens if it goes unchecked, because a lot of people think that they're going to lose their baby teeth anyway. So what would happen if we do nothing?
Well, if you do nothing, they can end up with infection that can cause problems and damage to the permanent teeth. Plus, if those teeth are removed or lost early, that whole area collapses down and now you don't have enough room for the permanent teeth to come in. So they come in very crooked or very malaligned, and now it takes a lot longer for ortho and everything to straighten them out.
It's like a snowball effect through life, isn't it?
Yes.
So let's talk about, because they're kids and we have a cavity, how do you treat cavities in children?
Well, how we treat cavities in children is we have a laser that we can use in the office. It's one of about 1,000 in the whole world. And with this laser, we don't have to numb the majority of patients. So we use the laser, remove the decay, fill the tooth, and you leave as if nothing ever happened. And now you have cavity free.
Well, and probably a good experience for a child to have a pain-free experience, right?
Oh, it's a fantastic experience. So now they're not afraid to come back to the dentist.
Right. All right, so before we get into that, like go to that route, how do I avoid cavities? What's a good plan to avoid cavities?
A good plan to avoid cavities is regularly brushing. You should be brushing 2 to 3 times a day and doing adjunctive things like mouth rinses. You could be water flossing. All these things help prevent cavities, plus coming in regularly for a checkup so we can make sure that nothing is going on.
Sure. And you talked a little bit earlier about the effect, very quickly, that juices have on cavities.
Yes. Most people think, oh, they're drinking juice, so it's fine. But unfortunately, most juices are loaded with sugar, and that sugar causes decay. So the decay is not a linear process, it's a cyclical. So every time that you expose the teeth to the juices, milk, anything that has some sugar in, it causes the tooth to start to decay.
Well, doctor, I want to thank you for giving us some good tips to avoid cavities in our children, and thank you for watching To Your Health.
The preceding was a paid advertisement.